Good morning, good morning, good morning. Thank you all so much for your patience. We are super excited about Substance Abuse Prevention Day 2022. Come on in, find you a seat. We know there's some people still checking in, but we will welcome them as soon as they come on over. Thank you all so much for being with us today. We are super excited. My name is Carmen Caldwell. I have the amazing, awesome, and privilege and responsibility to kind of be our flow leader for the day is what I'm calling myself. Facilitator, host, whatever name you want to call it. Thank you. I got a couple hand claps over there. I appreciate it. Thank you so much. Glad to have you all in the building. I am, again, so excited. I know it took a lot to get here today, but we are finally here and excited for what we'll learn, what will transpire, the networks that will be made, the connections that will be made. We do have an online community, some folks joining us virtually. So if you're on this side of the room, just look back. You can wave back at them. Hey, y'all. Let them know we're in the building, that we are really, really here for real, and we want to welcome them because they will have an amazing experience. Even though they're joining us virtually, they will still be with us, and we'll be able to experience them in the room. We have online, on the screen in the back, a social media wall and chat where we'll see folks who are using the hashtag for today. They'll be chiming in, and we'll be able to track some of the comments. So we have a really interactive experience for us today, and I'm just super excited about the technology. And while it doesn't always work when we want it to work, it's coming through for us right now. So I'm just grateful for that. Again, I want to welcome everyone here, and we're going to go ahead and get started with our program as printed. We have a special introduction guest speaker, some remarks from the OBHPFG, HIJKL, no, I'm joking. But we have from the Office of Behavioral Health and Health Promotion and Federal Grants with DBHDD, the Assistant Director, Donna Dent. And I want to read her bio as she comes up. I know she's like, no, don't do it yet, Donna, I'm going to do it to you. I'll shorten it if that's okay. That's okay. I'll make it a little short. So Donna Dent is the Assistant Director of the Georgia Department of Behavioral Health and Developmental Disabilities Office of Behavioral Health as the Assistant Director of DBHDD OBHPFG. Ms. Dent assists the director in planning and overseeing the office's substance abuse prevention and federal grants. The Prevention Office provides statewide guidance services addressing substance abuse prevention, suicide prevention, and mental health promotion. So I'm going to cut it short, and with that, I bring to you Ms. Donna Dent.
Thank you, everyone. I'm excited to be here and to see all of you guys. I'll keep it short. I know we're rushing for time today. I'm plenty of time. Okay. It's good to see all of you guys. I see some older faces and some newer faces, people who've been here a while. That's really exciting. And I'm just excited to be in a room with people. But I'm also excited to see you guys online virtually. I was looking through some of the names, and I'm excited to see, like I said, some new people on board, as well as some senior staff and experienced professionals that have been here. I really just want to congratulate you guys for coming today and for being a part of this advocacy. It's really a legacy that we try to leave to the next generation as well, for you to understand that I view you and us as your community warriors. We are here today because we care and because we want to be a voice for our community and for our neighbors and our families. And I truly appreciate, and DBHDD truly appreciates the work that you do and the commitment that you've made. And I know that it's a hard journey sometimes, and it takes a long time for that ripple to make that effect across that entire pool. But you have to remember that it really, really does, and that we have to keep that drumbeat marching on, keep that ripple moving forward, that it does make that impact. I have seen it in my lifetime, and I have seen it with the work that we've done from the predecessors that came before me. So remember that. None of us does it alone, and that's part of why we're here today, is to build that voice, to become that lone voice that joins and unites with a multitude of others to have that impact on our entire community that we work with, and to help change the world, to make it a better place. So I'm proud to join with you in this work and to go on this journey to discover, to experience, and to improve the world that we live in and the communities that we live in. And I appreciate seeing all these young people here today as well. Again, you are our next generation. You are our legacy, and we appreciate all the work that you're doing, and we are so proud and excited to have you become a part of what we're trying to do, and become a part of what you're trying to do in your neighborhoods, because this is your projects as well as ours. We do this together, united, and that's what we need to remember always. We have different voices, but we come together as one united voice to really be heard, to be that drumbeat that moves forward and keeps going on. And so for today, I hope that you will take this time to learn as much as you can, to get your questions answered. Make sure you ask as many questions as you can. We love that. And then to walk away today with not only having goals that you want for the upcoming year or the next month even, but also having a plan of action, of next steps, things to do, people to talk to, so that you can keep moving forward in your goals and in your community and the project that you want to achieve for this year and the years to come. So thank you again. Glad that you're here. Department of Behavioral Health, we have a lot of acronyms, a lot of alphabets. We call it DBHDD, but we're here, we're online, and we're proud to support the work that you guys are doing. And visit our website if you have additional questions. There's always someone in the office that can help you, assist you in getting additional resources or finding out additional information. Thank you and welcome. Have a great day.
Awesome. Thank you so much, Ms. Donna. And I just want to call your attention to a few things or themes she had within her message for us to be thinking about, really setting the tone for today. So thank you so much. That we are a community of warriors, that we are community warriors. Did you know that about yourself? I was like, okay, I like that description, right? So I don't know what your warrior face looks like or how you want to be a warrior, but stand up, right, in our communities, that we are warring against substances being used in our community. We're warring against the industry that is coming to our community and to our state to impact our young people. So I love that description as community warriors. That's something in me just kind of leapt when I heard that. And then also that there are ripples coming across the water. So there's small things we may be doing, but it's going to have a ripple effect. And sometimes in this work, it may feel like it's not really making a difference, or we're not sure if we're making the impact, but know that everything you do, every phone call you make, every meeting you attend, every policy you advocate for, that is yet another pebble going into the lake to make this ripple that we will see ultimately. And the other thing you mentioned was about our youth being the legacy. And so they're our legacy, but they're also our now. I love that you mentioned that too, that they're here now. So you're not just here, youth, for a day out of school, but you are really here to impact your community. So I'm so excited that you are with us today. So I love that message. Our theme for today, our Substance Abuse Prevention Day, and actually for the year, is to tune into 2022. And while we may be singing different notes, we are singing in harmony, right? We're all working together to make sure we move forward substance abuse prevention within our communities. I want to also bring to your attention that we have prizes. Say yay! Yay! Oh, y'all not excited. So maybe we don't bring the prizes out. Maybe we just leave them in the back. We have prizes. We have prizes. Well, let me tell you what they are. Maybe that'll get you excited. We have 4 giveaways for Amazon gift cards. I don't know about you. That's my favorite store to shop. We have some earbuds we'll be giving away, a cool camera it's a camera and microphone and anything you need to do online, so for videos and whatever you do. So we have a camera we're giving away, and last but not least, we have a tablet we're giving away. So when I say we have prizes, we have prizes! Okay, all right. And then also in the back of the room, we have a banner for you to go back, take your pictures, post on social media. I cannot remember, I should know this, our hashtags for today. Can somebody yell that out to me?
The number 4P, hashtag V4P with the number 4, and hashtag Prevention Day.
Okay, hashtag V4P, the number 4, GA, and then hashtag Prevention Day. Is that right? All right, we're good to go. So those are your hashtags you want to use. And then also we have a virtual photo booth. So set up in the back, if you use your phone as a QR code, scan that QR code, you'll be taken to a virtual photo booth where you can take pictures and post on social media. So we want to light up social media today, and we want folks who are not in attendance to wonder, like, why didn't I go? We want them to feel like they should be here next year. Again, welcome to our people online joining us, our virtual folks. We have not forgotten about you. There are prizes for you based upon your levels of activity today. So there's points that you're receiving based upon the booths you attend, the virtual booths you attend, your interaction, all of those things. And so at the end of the day, there will be prizes given away for those folks online. So we didn't forget about y'all online, right? All right, so I want to take this time now to bring up Shannon Lawson, who is going to take us to an activity about why advocacy is important. You know, why are we even here today, so that we can make sure that our voices are heard and we can tune into 2022. Shannon, take it away.
Shannon, put that real close to your mouth.
Good morning, good morning. So this is the part in the agenda where we stop and sing because our theme is tune it. No, I'm just kidding. Just kidding. But wouldn't that be fun if we had a little choir practice? Okay, they didn't ask me to do that. But they did ask me today to talk about why I advocate and to talk us through a little activity we have. So I will have you pull out your folder for today, and online, our online friends, there's going to be a connection in the chat, or possibly visit the V4P virtual room to receive to link up to our I Advocate Because sheet. So in your folder, you're going to pull out this I Advocate For sheet, and you have markers on your table. All right, rustling of paper is always good. Awesome, awesome. So while you're finding your I Advocate Because word bubble and locating your markers on your table and being good sharers to your friends and neighbors, I'm going to talk a little bit why I advocate. So my name is Shannon Lawson. I work for the Council on Alcohol and Drugs. I work around prescription drug abuse prevention in the great community of Thomaston, Upson County. And I work with that community to help reduce prescription drug misuse and abuse. And we do a lot around safe storage and secure disposal. But the passion within me to do this work and why I advocate for the work daily, on a daily basis, is because I desire a healthy community. I desire my community to be as healthy as possible, and I find that work in prevention and the advocacy work that I do on a daily basis helps me help my neighbors and myself be as healthy as possible. Now, you are in the room and you have different reasons for why you do what you do. And you have knowledge base, and that knowledge base meets passion, and when those two things meet, then you advocate for that, right? So you may be able to fill in your bubble sheet right now, absolutely know exactly what you need to put it right there, why you do the work. But you may be here and go, I don't know. I'm not sure. I don't know if I can put a describing word on my sheet yet. And that's fine. We hope by the end of the day today, or as you network with your friends and neighbors and new people that you meet, you form a community of advocates that you can rely on, that you can learn from. There's some great people in this room, awesome friends of mine that I've had the pleasure of working with beside for many, many years doing this work. And they have some awesome answers, I know, that they can fill in their bubble. Anybody want to share right off the bat something they can put in their bubble, and I'll shout it out to our virtual friends? Any virtual friends, let me know, Michael, online, why they advocate. Caitlin.
I advocate because I care about the youth in my community.
Awesome. Caitlin says she advocates because she cares for the youth in her community. Anybody else want to step out on that ledge, my friend, and share their I advocate because bubble? Going once.
Am I on?
Oh, okay, we have, yes, ma'am.
I advocate because I have seen what substance abuse can do to families.
She advocates because she has seen what substance abuse can do to families. Thank you both ladies for sharing. I know there's a myriad of other wonderful answers in your word bubble. What I ask you to do is fill it out if you're ready to. At some point today, snap a selfie with it, or just a picture of the form, and maybe use those hashtags we told earlier and upload it to your social media pages, and those will get on our social media wall, and we'll just fill the world with why we advocate, why we do what we do. I just love that. I'm so awesome. Just so happy to be here. This is like I was counting up like my 6th or 7th time being at Substance Abuse Prevention Day, and every day I get so excited when I roll up in Atlanta. I pull into the Sloppy Floyd building or the Pete Hackney parking lot. I try to figure out how to get over here, and I remember you got to go to the 5th and then the 3rd and then the 10th and all the things. And then I walk into the room and I see my friends, and it makes me so super happy. Thank you for being here. I'm going to turn this back. Oh, where am I turning it to? Oh, back to the extraordinary Carmen Caldwell, people.
All right, so do we hear from some of you all about why you advocate? I had to step out for a moment. Okay, awesome.
We have some online.
I was going to say, and I wanted to let our online folks know, you know Michael Davis, so you may think he's just hanging out, but he's actually here in the building, and he's representing you all online.
Yes.
I know we have the Michael Davis in the building with us.
All right.
So, Michael, what are some of our folks online saying about why they advocate?
All right, so we have some people saying they advocate to break the cycle of addiction in family because substance abuse has negatively impacted my family directly, the personal stories, to protect people of the consequences of substance use, for community health and wellness. We have a lot of different people online that are so excited. They want to keep youth healthy, and they advocate because of the effects of substance abuse and the effects on the families that are involved. There are a lot of youth voice, and a little shout out earlier was they were excited to see how many youth are in the room right now.
Yes.
They were so excited to see youth come in and are sad they can't join in person, but they can't wait to be back here next year in person and doing all the good work.
Yes, so advocacy is important, and your reason for advocacy, your reason to advocate, like that's core to who you are. I'm glad that you're using that as the motivation to continue to do that, and we know that advocacy is not just today. It is year-round. It actually happens in your communities as you're talking to local leaders, as state leaders are back from they may be out of session into their local offices, that you're making those appointments and connecting with them. And so it's not just today. It is year-round, and it makes a difference. I was just, this is not related to substance abuse prevention, but I was just talking last night about my grandmother. I remember when the seatbelt laws, and I mean, every time she click it or ticket. And can you imagine like the point we'll get to where folks know that we'll have our same kind of clicker or ticket, if you will, legacy within substance abuse. And we've seen that with alcohol policy changes within our nation, also within our communities. We've seen you all doing the work around substance abuse and opioid prevention within your communities, tobacco prevention. So we have our click it or ticket things that are going on, but all of that happens with advocacy. All of that happens with you using your voice, or we using our voice together to unite for change within Georgia. So thank you for the work you do. Thank you all for participating in that exercise. We do have a few giveaways. I want to give away at least one giveaway right now, one of the Amazon gift cards. So if you have your red ticket, pull it out. We are ready to do a drawing. We have Ms. Nicole Dinsmore, who is the program manager for Voices for Prevention. She will be coming with our drawing in a moment. Let's give her a round of applause as she comes. Woohoo, Nicole! So everyone has your ticket out and ready to win. Who's gonna win?
Me.
All right, you gotta have faith. You gotta believe. You gotta have faith. It doesn't matter which color. Okay, I have my eyes closed, and I'm gonna pull one. All right, we have, the number is 666021.
I'm about to say that. No, man.
666021. Those that are superstitious, just plug your ears. 666021. Who's got it? 021. Nobody in the building?
I was looking at it like this.
I know, right?
00999.
So all gifts that are not claimed default to the presenter.
Yeah.
Oh, you can't. Oh, someone has it, but they're not allowed to take it. So try again. So if it wasn't you called this time, now is your time. All right. 666029. All right, awesome. Woohoo! All right. Oh. Gift card. All right.
You want her to
All
come
right, come get it, girl. Come get it. Act like you want it. Come on down. You're too young to know that show. Come on down. Congratulations. And we'll do one more while we have Nicole here. All right. Mix them up again and pulling 1666046. All right, we got to use, come on down. Woohoo! Let's come on, girl. All right, so we have two our giveaways today. You got it. Are you excited? Congratulations, congratulations. And remember online that we have prizes for you as well that will be determined by your level of points as you continue to interact with our platform. We have coming up now some recorded messages. Some folks could not be with us today, but they definitely want to send their well wishes and send their messages to us. And so we'll be playing a video, so turn your attention to the screens.
This is Governor Brian Kemp.
And I'm First Lady Marty Kemp.
We're honored to welcome you to the Capitol in observance of Substance Abuse Prevention Day. It's exciting to see Georgians once again gathering under the Gold Dome to celebrate and raise awareness of causes dear to them.
As we know, substance abuse can affect anyone, regardless of race, gender, or financial status, and it has a devastating impact on the lives of those struggling with addiction and families alike.
To help combat the epidemic of substance abuse, public and private sector partners across the state are working to educate Georgians about the dangers of addiction.
These prevention efforts are saving countless lives and putting those on the path to dependency back on the right track.
Thank you all for helping to protect our communities and for supporting those on the road to recovery.
We pray for your success and that God blesses your good work.
God bless.
Hello, everyone. I'm State Representative Sharon Cooper, Chairman of Health and Human Services in the Georgia House. I'm also a nurse, and I am speaking to you for the Council on Alcohol and Drugs and asking you to tune in to 2022. Being addicted to a substance in many ways is just like other illnesses, but it's hard. And it's hard when you've been isolated. So I would ask you not to give up hope if you did slip during this 2 years of isolation, and to start anew and to know that you can succeed and that you should not feel like a failure because you didn't make it on the first try. As long as you're alive, there's hope for the future. And prevention is so important as we work with people across our state. And I thank everyone that might see this tape that is in the area, in the arena of working with prevention and helping our citizens with their addiction problems. Thank you for that, because it is so important. It's much easier to prevent someone from becoming addicted to alcohol or drugs than it is to help them get off alcohol and drugs. So thank you for all you do. To those that have that problem, please don't give up. Keep working toward changing your behavior and kicking your addiction. Thank you.
Good morning, everyone. I'm Senator Kay Kirkpatrick, State Senator from District 32, and I'm here to tune into 2022 with the Voices for Prevention and the Council on Alcohol and Drugs. The problem of substance abuse is not new, and it is important to look out for each other every day by ensuring measures are in place to promote awareness and inform others of the reality that no one is immune from the dangers of substance abuse. Over the past few years, the Senate has worked to advance legislation to assist those in recovery and ensure safeguards are in place when it comes to potentially dangerous substances. We have passed legislation to prohibit patient brokering and treatment programs, enhance transparency in prior authorization for treatment, and provide funding for recovery community organizations. The best treatment is to prevent people from developing problems with substances in the first place, because we know that recovery is a lifelong daily struggle. That is where education of the public, especially young people, is critical. The past 2 years of the ongoing pandemic have not been easy for anyone. Students have fallen behind academically due to online learning and have missed out on the social interaction that comes with seeing classmates and friends every day. We worked from home, isolated from each other. Unfortunately, this corresponded with a frightening rise in dependency on alcohol or drugs. That is why the work of Voices for Prevention and the Council on Alcohol and Drugs is so important, because educating and supporting Georgians about the dangers of substance use leads to more successful outcomes. Our goal is for all Georgians to be able to reach their potential and live a life free from dependence on dangerous drugs and alcohol. I encourage all who may be struggling to reach out to organizations like the Voices for Prevention and the Council on Alcohol and Drugs to take your first steps towards recovery. I hope days like Substance Abuse Prevention Advocacy Day at the Capitol serve to raise awareness of the important issues faced by those in our state. And I'm grateful to Voices for Prevention for allowing me to speak at this very important event today.
All right, thank you. So, y'all, we got the governor. We're big time. I just want to say, I don't know, I want to pop my collar a little bit, but you know. But thank you. Although they're not here, we want to thank them for taking the time to record those messages to continue. It's great to know that we have people and advocates in the Capitol under the Gold Dome that are working in these efforts with us. And just know that, again, they are counting on us to bring them the information, to educate them on the issues within the community around substance abuse prevention. And so that's why we're here today, to really for ourselves to get understanding. There's going to be some activities in a moment. We'll have that you're able to get more information and connect and network even more around specific substances, so we can take that information back to them, and we will see that show up in the policies and how those are implemented within our state. I want to continue our program. We have two amazing speakers, but our first speaker today, I won't introduce them, but I will introduce the person introducing them. From Hancock County Teen Advisory Council, we have Ms. Taylor Freeman.
Vignette Menon is a junior at Lambert High School in Sewanee, Georgia, and the youth sector leader for the Forsyth County Drug Awareness Council. He has been actively involved with his coalition for the past 3 years and represented his district at multiple CADCA national conventions. Vignette's prevention efforts include conducting awareness campaigns, advocating for substance use prevention, with state and national legislators, along providing resource guides to communities in need. Vignette's current project focuses on distributing drug disposal kits to eliminate unused or expired prescription medications and combat the opioid epidemic. Outside of prevention, Vignette is actively involved in speech and debate and Georgia's Future Business Leaders of America. Please help me welcome Vignette Menon.
Well, good morning, everyone. Thank you so much for that introduction. My name is Vinayak Menon, and I'm excited to be here today at the Substance Abuse Prevention Day in the state capitol. I hope you all are excited too. First and foremost, I want to thank Voices for Prevention for giving me this chance to speak and share my perspective as a young leader. And I'm so honored and so inspired to see other young folks in the crowd today because our voices truly do matter. As you all know, we're gathered here today to tackle one of our state's most urgent crises, the wave of substance use and addiction that seems to be getting worse by the day. And the perennial question is, how do we stop it? How do we stop more lives from being lost and more families from being hurt? What I want to talk about today is how youth, who are disproportionately affected by this crisis, can not only be part of the solution, but pave the way to a safer, healthier, and more vibrant Georgia. When youth become advocates and deeply embedded in our campaign for prevention, true change can occur. You see, youth advocacy is a powerful force. It's a process by which youth can take a platform, can take a seat at the table, and have their voices heard. It's an opportunity for youth across our states to truly give back to their community and take charge of prevention. Let me tell you about my journey with youth advocacy. About 4 years ago, I joined my county's Drug Awareness Coalition. And the reason I joined is because I saw firsthand how this crisis of addiction was affecting peers in my community. With heavy burdens of stress and anxiety placed on their backs, many youth turned to substances for relief. They were becoming addicted to nicotine, and some were losing their lives to prescription opioids and fentanyl. You see, I was taken aback because I once believed that I was isolated from substance use, that I would never come across it. But the truth is that substance abuse sees no boundaries or barriers. No matter your geographic location, your socioeconomic status, your racial, your ethnic, or your religious group, substance use is a present threat. It's a present issue. The truth is that substance use is not an issue in isolation, but it's a symptom of the deep systemic issues in our societies. When people are facing problems with mental health, when folks are facing generational trauma and they lack access to basic health care, those are the people that are most at risk of developing a substance use. It's a confluence of risk factors that causes addiction. So it was this realization that drove me to create change in my community. And I can proudly say that for these past 3 years, I found true happiness and joy in being part of the solution to addiction. I've written articles about the effects of substance use. I've talked to key members of Congress, people in the House of Representatives and the Senate, and I created a campaign to distribute drug deactivation kits so no family in my county would have to worry about the unused or expired prescription pills in their home medicine cabinets. And through this journey, I've gained so much knowledge and inspiration. I've met incredible people in the world of prevention, healthcare professionals, policymakers, and trainers. Now, all of this was possible because of that first step of taking action and speaking my truth. Now, I will note that it's not easy to be involved in prevention. Folks, it takes courage, it takes hard work, and it takes compassion. But I can tell you from personal experience that there is nothing more rewarding than seeing change and seeing improvement in your community. So I ask all of you today, the advocates, the change makers, and the preventionists, to empower youth in your communities. It's young leaders that can act as a bridge between your organization and the folks you hope to educate. It's young leaders that can bring your messages to new audiences, and it's young leaders that can build momentum. They can take their passion and bring more and more people on board, turning your vision into a reality. Now, bringing young folks in it's not a simple task. It requires outreach in the schools, with parents, family, social media. All of that is necessary to reach this next generation of Americans. And beyond simply reaching them, you have to engage them. It's incredibly critical to give them the opportunity to contribute, to have their voices heard, and above all, play an active role, not a passive role in prevention. And to the aspiring young leaders here today, there's a lot of you here today. My message is this: take action in your community and speak your truth. Take action no matter how big or how small that action may seem to you. Whether it's writing letters to your representatives, volunteering at one of your organization's events, or even just putting flyers in your school, you can make a difference. As the late Archbishop Desmond Tutu once said, do your little bit of good where you are. It's those little bits of good put together that can overwhelm the world. Prevention can overwhelm the world. Young leaders can overwhelm the world. It's the next generation of America that can move this country in the right direction and tackle this urgent crisis at hand. Thank you so much.
A round of applause, yes. So powerful. I'll kick it off to Michael just for a moment. I wrote down comments, but I'm still trying to catch my breath. Are there anything from online folks are saying?
Absolutely. We were talking about future president up here.
Right. I was thinking the same thing. 2022.
Future president. We are here on that. Man, this young man is impressive, said Kathy with Nicole McDade. His voice is capturing my attention.
Yes.
Present threat knows no boundaries, and you really talked on that. And just talked about you're captivating, and they're so impressed, and that you should start a public speaking group at your school, which you probably are in already, or in some ways. But take action, no matter how big or small. Those little bits of good can overwhelm the world. So they were totally on there, and they've said that I was your hype man before this because I've been saying all morning how excited I was for you to speak. And so he's been your hype man. So I'm ready on there. So if you need a hype man, I got you, okay? On there. Yeah.
Awesome. And I saw as Michael was reading those comments, all of us nodding our heads to everything they said, including whenever you run for office, I think you got a room full of folks that are ready to vote for you. So thank you so much for those inspiring words. What really stuck out to me was, and I think you already, Michael mentioned it too, was that prevention as well as young leaders, that we can overwhelm the world just a little bit at a time. And so, and empowering our youth to be involved is so critical. And so again, to our youth today, know that you have the support of all of us in this room and all of us online, the virtual community, to do that which lights your heart on fire. And we want to support you to make sure you do that. And I want to say he did this amazing talk today and all of that, and he has a macroeconomics test to take after this. So I think that deserves even a greater round of applause. I think about, wow. First of all, when he said macroeconomics, I was like, whoop, I'm already out. Like, yeah. So thank you again so much. I want to, next we have another speaker coming up to us, a dynamic speaker who I think his reputation precedes him as well. And I have coming up, I won't introduce him, I will introduce the person introducing him. From Hancock Teen Advisory Council, we have Mr. Michael Hosley.
Carlton Hall. Carlton Hall is the president and CEO of Carlton Hall Consulting LLC, a multi-faceted, full-servicing consulting firm designed to provide customized solutions and enable measurable change for communities, organizations, families, and individuals. Carlton spent 12 years with the Community Anti-Drug Coalitions of America, CADCA, serving in several leadership positions and including most recently acting vice president, training operations, and acting director of CADCA's National Coalition Institute for the day to operational oversight, design, and implementation of its premier national training delivery system. Carlton also supported CADCA's international programs in partnership with U.S. States Department International Narcotics Law Enforcement Division, INL, managing training programs in Kenya, South Africa, and Ghana. Carlton is one of the primary architects of CADCA's National Coalition Academy. The Academy, a year-long coalition development program, is designed to increase effectiveness of communities in drug demand reduction, producing populational level outcomes. Please help me welcome Mr. Carlton Hall.
Hey, everybody. Good morning, good morning, good morning, good morning, good morning. First of all, I want to just say thank you to Esther and Harry and everyone who was a part of making sure that I had the opportunity to be invited to this event. I'm extraordinarily honored to be able to be here and to have just a few moments to be able to speak with you all and share some thoughts with you all. But I want to know who was the person that decided it was a good idea to put me behind Vinayak. That is a hard act to follow, and I'm not even going to try. I'm not even going to try. He did a remarkable job. Let me tell you about two other individuals that did an even more remarkable job, and that is his parents, who happened to be in the audience. Could we give them a round of applause as well? I had the great privilege of being able to meet his father actually at the CADCA conference. We met just very, very briefly after Vinayak gave another rousing speech at the CADCA conference in Washington, D.C. And you all have raised a remarkable young man who is going to do some remarkable things. And he is just a representative of all the remarkable young people that are here today. And so I say thank you to you all. I say thank you to everybody. I just want to be able to share just a couple of thoughts with you all before I go. And if this works, y'all can hear me? I'm good. Here's the thing. This is a remarkable day. This is a remarkable moment. This is a remarkable opportunity. And I want to start off simply by sharing with you a quote. And this is from a gentleman by the name of Simon Sinek, and some of you may know that name, but he is one of the leading leadership gurus in our nation right now. And one of the thoughts that he shared, I think, has great resonance for who we are and what it is that we're choosing to do and what it is that we're trying to be. He says, people don't buy what you do, they buy why you do it. And the thing that resonates with me around that is the fact that we're really, really good at sometimes expressing the what's that we do, right? We got the 5 phases of this and the 7 steps for that. But we have a hard time articulating and compelling folks to understand the reason why we do what we do. If we can find out how to connect with people who believe what we believe, we might do a better job at that. And quite frankly, that caused me to think, what is it that we believe as preventionists? I'm a preventionist. I stand here proudly and share with you that I'm a preventionist. And what does that mean? That means I believe 3 things. 1, I believe that the most effective way to stop a problem is to prevent it from starting in the first place. 2, I believe in the full engagement and empowerment of the community to be a part of not only understanding that problem, but be a part of solving that problem. And 3, I believe in the opportunity to make sure that we're guided by science in order to produce population level change. That's who we are. That's the core of this day. That's what this day is all about. But why does it matter? And I'm going to tell you why it matters. If you look at this map, I had the opportunity of working with the Drug Enforcement Administration on an initiative called DEA 360 program about the opioid crisis. And this map shares with you just a pictorial display of the saturation of of prescription opioids in our nation, right? And without going into great detail, just basically everywhere you see purple is in trouble, right? And so there's a lot of purple on this map. And I'm gonna tell you what that caused for me, because something happened for me in the last several years that actually radically changed the way I view things. If I view this as my house, I have to tell you that in my house, in my household, I've had a radical change, and that radical change is that my wife and I became grandparents for the very first time, right? And my son and his wife gave us our first grandchild, our grandson, Ethan, right? And then 10 days later, my daughter gave birth to twins. And I don't know how many of y'all, I don't know how y'all do it down here in Georgia, but that's right. If you're doing the math, I went from 0 to 3 in 10 days, right? And let me tell you what that means. As a grandparent, right? There's a secret that I'm gonna share with you that every grandparent in here knows. Listen, that every grandparent in here knows, and that is that God gives you a present that you can't open until you're a grandparent. And when you become a grandparent, you open it up and you find out that there's a whole level of love that you never even knew existed, right? It has radically changed the way I view everything. When I go to visit my grandchildren's home, they call me Babu. That's Swahili for grandfather, right? And so when Babu shows up, I'm expecting the heavens to open up. I'm expecting the trumpets to blare, right? Because Babu showed up. But let me show you what happens. I go to my kids' home and I find that even though I have a couple of degrees, I can't figure out how to open up that daggone thing and navigate the steps. I'm hungry for a snack, and I can't figure out how to open up the daggone cabinets when I get into the kitchen, and I can't call anybody because my phone, I can't figure out how to charge my phone and plug my phone in, and I don't mean to be rude or crude, but I'm over 50, and there's just some places in the house I just don't think should ever be restricted. But here's the point that I'm trying to make. Who's the priority in this house? Is it Babu? Who's the priority in this house? The babies are the priority in this house. Is there any doubt who the priority is in this house? Absolutely none. There's no doubt who the priority is in this house. Who's the priority in this house? Because what I'm going to tell you is that it is not clear at all. And here's the message of prevention. Prevention is about identifying the most vulnerable population and identifying where they are most vulnerable. In other words, the environments that place them at greatest risk. Prevention should be obvious, right? Just like that gate at the top of the stairs, that's an invisible danger until you make that invisible danger obvious. The job of prevention is to take the invisible dangers and make them obvious. Does that make sense to anybody here in the room? This is what the day is really about, because here's the reality. We have to do this across the lifespan of our young people's lives. This is real stuff that you're working on, and in a very real sense, this is what today is all about, because here in this great state, this is what you're doing. You have peer-assisted transition projects going on in which you're helping young people being paired up with older young people. I think maybe some of you all might be a part of that, but helping to lead young people through some important transitional periods. You have programs that are associated with underage drinking, looking at how you might be able to mitigate the harms associated to prescription drug misuse. You are building upon that by making sure that we're reaching out out beyond generations. You're looking at how we're stopping alcohol from being a threat in our communities to our young people. You're engaging the community in how to promote these efforts over across, utilizing specialized media to be able to do that. And you have this remarkable program that I had the privilege of working with across the nation called the Drug-Free Community Support Program, which the NIACS Coalition is actually a beneficiary of. You all here in the great state of Georgia are doing some remarkable things through the council and through efforts like V4P, which is what it is that you all are doing. You're building bridges of connection. And you're building bridges of connection during a time where at no other time in our society have we ever had public health and criminal justice coming into contact with each other. Does that make sense to anybody? And what I'm sharing with you is that the cornerstone of this bridge is you, is prevention. This is the reason for today. This is what it is that we have to contend with, what it is that we have to do, because we are living in what Dr. King would refer to as a fiercely urgent now. This is the reality. Whether we're talking about the opioid overdose crisis, the opioid epidemic, whether we're talking about the literally growing debate that we are having to engage with across our nation around legalization, or the fact that there's a growing voice that is trying to promote hallucinogens as medication, right? Overseas, we are being inducted by new psychoactive substances that are having some devastating effects on us, like bath salts that are incurred in our communities. I don't have to say anything about the connection between the rising challenges associated with meth and cocaine and synthetic opioids, right? We know too far how devastating that is. And can anybody remember when all we were really trying to focus on was the vaping crisis that we were seeing affecting our young people? And guess what? All of that was before the pandemic, right? And as we are looking at this, what I want to share with you very, very briefly about this is that we were starting to make some things happen. We were starting to actually see some real progress being made. But since the pandemic, that trend is going in an unwanted direction, and in a devastatingly unwanted direction. In fact, in just this last year, we've seen the greatest surge of overdose deaths that our nation has ever recorded. I believe we're going to come well over 100,000 deaths just this past year associated with overdoses, right? So, I don't care what you're talking about. Every aspect of our work has been impacted by the current state that we are currently in. We are living in a very fiercely urgent now. So what is it that we can do with respect to this? One thing that we have to do is that not every community is being impacted about this in the exact same way. So we have to be attentive. We have to expand our vocabulary. We have to understand what does it mean when we talk about disparities and behavioral health disparities as being differences in outcomes and differences in services. This is something that Vinayak just brought up. We have to be able to attend to these things because guess what? Even though we may all be in the same storm, on the same ocean, in the same predicament, we're not all in the same boats, right? And so we have to be attentive to how can we support the efforts that are going on. And so I'm going to share with you just a couple of thoughts, and then I'm going to be out of your way, right? These are all based upon some work that I was able to do as I was working and helping to support some of the efforts that are across the nation with several federal agencies, including the Drug Enforcement Administration as we were doing this. And this is just lessons I learned. I just want to show you a picture and get your thought about this picture. I was working with a county, and this is after that county had found out that the overdose deaths were going in a very unwanted direction, right? And you can tell I've lived in the Washington, D.C. area far too long because I started redacting everything. So don't mind that. But if you look at the picture, right, can anybody tell me, this is the leading county prosecutor in this County, right, who called together a meeting because the overdose deaths in that county were surging, which is a fiercely urgent issue. Can anybody tell me what's wrong with the picture? Say it loudly. Nobody's there, right? Anybody else see anything else wrong? Say what? No diversity in the room, right? Here's what's even worse, right? I happen to know that this woman actually works for that man, so it's actually even worse than it looks, right? Here's the piece. Who's responsible for ensuring that those seats were filled? Is it about the fact that those folks just didn't care? Or is the ownership upon those of us who know that we are living in fiercely urgent times to make sure that we are conveying a very different kind of message and a very different kind of focus? We have to now begin to focus on engagement, because as preventionists, we've been really good at these first three steps, right? Defining the problem, identifying risk factors and protective factors. Vinayak was speaking about the great work that he's learned around doing that, looking at how do we translate that into a comprehensive set of strategies. But can anybody see that there's an actual fourth step in this public health approach? And that fourth step is where the rubber meets the road. That fourth step is exactly where we need to be. How do we ensure that great science is now diffused and adopted in our communities in a way that matters, right? So for those of you who are here as a part of Advocacy Day, I'm going to offer 4 ways and 4 ideas about this, right? Very, very quickly, here's what we're going to do. 1, I think these are vulnerabilities, but I think that they can be turned into opportunities for us. 1, we have to become clear in the way we communicate, right? 2, I think there is real opportunity for us to confront the realities of commercialization and the myths around marijuana and polysubstance misuse. 3, I think we need to be able to look and explore the potential of youth leadership in a way that matters. And lastly, we have to be able to do that in a way of engaging effectively and equitably in our communities. So, a couple of ideas about how we do this. And somebody tell me when I have about 5 minutes, all right? Let me know when I got 5 minutes. Just get up and start doing jumping jacks or something, all right? Here's what I'm gonna share, right? Communicating with clarity. Somebody tell me, which way is this cat going? Cat going down? You got down, up, down, up. What you got? Let me tell you. The cat's going whichever way I decide it's going, all right? Right. Exactly. What's the reason why I did that? I did that because it's about perception. And perception defines what you communicate, right? Let me show you another picture. This is a graph that shows you a chart, and if you look at the different colored lines represent different substances, and the use of those different substances by high school seniors in the past 30 days, right? From the mid-70s all the way through to today. And if you look at just the trend, just look at the direction in which the lines are going, right? They're going down. They're going in a very positive direction, right? That's good stuff. That's the result of your work. That's the result of advocacy efforts like today. Except if you look at that green line, which is ironically representing marijuana, right? And there's a reason why that started to go in an unwanted direction lately. And what I will share with you is that when we look at the inverse of the question, when we look at no use, those young people in the 12th grade that said, I am not using anything, right? Not using anything. Look at the direction in which that line is going. It is going in an extraordinary positive direction, which means the fact that most of our young people are not engaged in substance misuse, right? And if you don't hear anything else that I'm saying today, what I'm sharing with you is that the real result and real efforts that we're trying to get involved with is to make sure that those lines continue to go in this direction. This is all good news. This is all good efforts. This is all the results of your great work. And what it is that we have to do is we have to recognize that we have to do that in a very smart and strategic way. And so in order to share that, I'm going to share this real thought with you, all right? Hamjambo. Habari yenu? Ni vizuri sana kuwa nyumbani. Ninyi ni watu vizuri. Mungu awabariki. Mambo sawa sawa. Mambo sawa sawa. Oh, come on, mambo sawa sawa, y'all. There ain't a mambo or a mama sawa in a bunch. All right, so anybody recognize? You might not recognize what I said, but did anybody recognize the language that I was speaking? That was Swahili. Exactly right. Exactly right. And so I'm the very first person in my family that had the opportunity of going back and not only touching the continent, but working deeply in the continent. And I found I had a propensity for a language I had never heard before. So what I said hello. I said, how are you? I said, you all look beautiful to me. Forgive me, brothers, I was saying beautiful, but you get, I'm talking handsome too, right? I said, thank you for making me feel at home. I'm excited, let's get started. I'm excited, let's get started. I'm excited, let's get started. Was there anything wrong with what I said? No. But it didn't elicit the response that I was looking for. Why? Because you couldn't understand what I was sharing, right? As we're trying to engage our state in this phenomenal, urgent work of prevention, there is no shortage of folks that are wanting to be a part of this. But what I will say to you is that when they come to us and they're asking us how can they be involved, here's what we say. You can be involved by understanding the strategic prevention framework, right? Which is this 5-phase process. And if you like that 5-phase process, I got another 5-phase process called community state care. And if you like that 5-phase process, I got another one called collective impact. And if you like that one, then I have another one. You have to understand the social ecological model. And that social ecological model is guided by the social development strategy. And the social development strategy is actually linked to the social ecological model. And that social ecological model has to have an asset-based community development process. And if you understand that, then you know the 40 developmental assets, and 40 developmental assets has to be informed by the social investment strategy. And that social investment strategy has to be determined by the social determinants of health. You can't do anything without the social determinants of health. And that means that you also have to understand screening, brief intervention, and referral to treatment. And if you understand all that, then you can understand health in all policies. And if you understand all of that, then you understand that you have to put all of that into context. Right? Right? So what is it that we have to do as we are engaged in this work? Is we have to understand how to make sure that we are clarifying the role of preventionists in this work. And what I'll share with you is that we have to do so by making sure that we are translating and clarifying, which means we're helping communities to prioritize well. We have to make sure that we're helping folks to understand how to focus locally, which means that we're concretizing the efforts and the works in ways that matter to folks. We have to be able to define our strategic leverage and make sure that they're able to strategize effectively, and lastly, engage equitably. And what I will share with you is I'm going to share 2 more thoughts, and then I'm going to get out of your way. The issue around marijuana is very, very clear. It is becoming the most misused substance in our nation as of today. The growth of that and its relevance to other misuse, substance misuse, is clear and it's evidence. This is from the Substance Abuse and Mental Health Services Administration. And what you will see here is that the red indicates where there's no past year of marijuana use, the blue indicates where there was any past year of marijuana use, and the green represents where there is past use, either daily use or almost daily marijuana use, associated with other substances like opioid misuse. In other words, the more they were engaged with marijuana, the more they were engaged in opioid misuse. The more they were engaged in heavy alcohol, the more they were engaged in marijuana. The more they were engaged in marijuana, the more they were engaged in cocaine use. If you look down here, the more they were engaged in marijuana, the higher the indices of major depressive episodes also being associated with this. And what I will share with you is that this is not merely about marijuana, even though I'm using marijuana. If I change this to alcohol, it would show the exact same thing. If I change this to cigarettes, it would show the exact same thing. Our country doesn't have an opioid crisis. Our country has a polysubstance misuse crisis. Does that make sense to anybody here in the room? And so the message that we have to be clear about is to help folks understand that we have a polysubstance crisis. No one is using just one thing. If they're using multiple substances. And so we have to be thoughtful about this. I was walking in New York City, and I came across this truck, brightly colored truck, right? And as I'm walking by, this lovely lady stuck her head out, right? And here's what she said. She said, "Hey, guy, don't be shy. Come get high. I got your gummies, I got your candies, I got your lollipops. Don't be shy. Come get high." I looked at her, I said, "Can I take your picture?" Nothing that this truck is selling has a THC value that would get anybody high because they're actually selling a lie, right? But how many of you agree with me that getting people high is not the goal of this truck? Somebody tell me what the goal of this truck is. Somebody. Say it out loud. Normalization. Everybody hear that? Because when you normalize something, you make it invisible, right? How many of you agree with me that some 10 years ago, a site like this would have been actually unheard of, even in New York City, right? But when you normalize something, it becomes invisible. I was walking in New York City just the other day on Valentine's Day with my wife, right? And not only were these trucks out there, but they actually had tables now, and tables that were selling edibles on the tables, just like any other vendor was selling hats and scarves. There were edibles. Normalization makes the visible invisible. Prevention has to make the invisible and make it visible. Does that make sense? I'm sorry, I may have messed that up. Prevention makes the invisible and has to make the invisible visible. And that's what the goal is. That's what we have to do. So we have to help folks understand that when we're talking about marijuana, we're not talking about that. We're talking about this. We're talking about a $50 billion industry. And what's the difference? The difference is potency, for one, right? We have to make sure that we're understanding that there is a issue around potency with respect to this unregulated field. Two, the delivery system. All the science suggests that if you change the delivery mechanisms of any substance, that substance will increase in its misuse. Does that make sense to anybody? Right? And so we have different methods that are being involved. Vaping is also a part of the issue. Synthetics is also a part of the issue. There is a huge danger, just like the top of the steps for my grandchildren is an invisible danger that needed to be made blatantly obvious. There are some invisible dangers in our children's lives, in front of our children, that we have to begin to make obvious. With that, the greatest champions for leading this cause can't be me, can't be anybody in a three-piece suit. Do you hear what I'm saying? If you don't know how to do the latest TikTok dance, you don't need to be in the game, right? How do we make sure that leaders like Vinayak, leaders like every young person that's on, leaders like the young man that introduced me and the young woman that introduced Vinayak, how do we make sure that we are able to pass the ball to them, allow them to move forward, allow them to bring their creativity so that they might be able to show us how to do this thing even better? That's what it is that we need to be able to do. And lastly, if we're going to do that, we have to do that in an equitable way, an equitable fashion, which means that we have to be able to do it in such a way that we're valuing all individuals and all populations, that we're recognizing and ensuring that we're paying attention to the fact that there are indeed some historical injustices that we have to contend with. There is a reason why if you go into some communities and talk about the opioid crisis, you're talking about a very different issue than if you're going into other communities talking about that same challenge, right? Because we have to recognize that there are differences in the historical injustices that have happened with respect to many of our communities, and we need to be able to provide resources in a way that matters, right? Health disparities will be eliminated when health equity is achieved. That has to be the aim, that has to be the goal, and so I'm going to end with this. Everybody should have an opportunity of meeting their heroes, and I am so grateful that I had the opportunity of not only meeting mine, but to spend a little bit of time with him. And he shared a thought that has become very popular. And what he stated is that ours is not the struggle of a lifetime or maybe even several lifetimes, but each and every one of us in every generation has to do our part. That's you. It's you. We all got to figure out how to do our part in this. So how do we get into good trouble? One, we can convey a message, a very clear message of how to prevent use of any and all drugs during adolescence, right? That's a very clean, very simple message. Is there anybody in this room that agrees with that message? Right? Is that something that we might be able to take on and advocate for, right? Two, we have to challenge the myths and educate the realities of commercialized marijuana and polysubstance misuse. We have to be able to engage parents and foster parental disapproval for youth use. There are many things we can do, but the most important thing that we have to do is begin to make prevention obvious everywhere we go. Will you help me in doing that? I'm trying to do that everywhere I go. I'm trying to do that all across the nation. Would you help me in being able to do that here in this state? And let me tell you why that is important for me. That is important to me because this is Ethan, and here are the twins. I know, right? That's Valentina. That's Carmen. They live here. They're in your house. I'm counting on you to help protect the home and prioritize my grandchildren, who are the most precious things to me, because they're in your care. Will you help me to do that? With that being said, thank you all very, very much for your time and for your effort. Thank you for who you choose to be. Thank you for the heroes that you've chosen to be. Thank you for this opportunity. God bless you all.
All I can say is, whoo, child. That was good. It was so awesome. It was inspiring, educational, and motivating, challenging even. Michael, what are they saying online?
Well, now the baby pictures have come up, so it's all adorable and so cute. Earlier, there was a comment of whoever thought the band on the toilet paper roll is genius. On there, they thought the band on the toilet paper roll was great. But they're in. They want to make prevention obvious in Georgia. They're all for it. They're talking about recognize and rectify the problems with cultural competency, the invisible dangers, a lot of just how great this presentation was, and really the polysubstance crisis. They're really stuck out, and we're excited about that, and how you did the whole SAPS training in like 30 seconds on there, and some flashbacks from that since we just taught it last week. So yeah. So. Awesome.
I was so moved by the building bridges of connection. and that we are the cornerstone as preventionists, as young people working in this work. We consider you preventionists as well, that we are the preventionists that really are the cornerstone of the bridge between that connection. So just powerful, the fierce urgency of now. I took so many notes, y'all. Look, it's all over the place. But I'm truly inspired in that we need to make prevention visible. I think that's a takeaway as well. So whatever nugget or whatever piece that you caught on today, either from Viniac's speech or from Carlton's speech or whatever has been shared today and will be shared today. We have some other activities. Take whatever. You can't take it all. You can't do it all. But take that one thing, those two things that you're going to hold on to continue to move us forward as we do this work within the state of Georgia. I think both of our speakers deserve another wonderful round of applause. So we do have a couple more Amazon gift cards to give away. So Nicole is making her way up here so that we can do that. So if you have a red ticket or it may be white ticket, I think there were multiple colors sent out, so pull it out. And we know that you have to go take that macroeconomics test. Go be great. We're sending good vibes to you. Go be great. All right. Let's see here. All right. Have your tickets. The number is 666034. Okay, we have another winner that can't win. Sure, you can give it to whoever you want to give it to. Okay, so she wants to give her gift card to Vinny. He's right here. So, okay. All right, so you can deliver that over to him. All right, we have another. All right, here we go. 666032. 666032. We got a winner. All right. Winner, chicken dinner. Actually, it's Amazon gift card, not chicken dinner. All right. Awesome. Congratulations. So we have our next activity. When you all came in, you all were given folders. And if you look in your bag, you should have a colored folder. There's red, there's green, there's yellow, and I think there's one more color, blue. And so those folders represent topics. And so you should be at tables that represent your topic. So get with other folks with folders the color of yours. And we're going to have conversations. We don't have facilitators specifically for each table. So I want you to now. So first of all, let's start with this part. Get with folks that have the same colored folder as you. So let's do step one. Are we all together? So look at your color folder. If you're red, get with some other reds. And there'll be multiple tables with the same color. So there may be 3 or 4 tables with red, 2 or 3 with green. I don't have the list of the numbers, but I don't think that necessarily matters. I'm looking over at the table. Just find people that have your color. So whether or not you have the number, your record number is the record number. All right, so we've done that. Awesome. Now, everybody put your right hand in the air. Right hand in the air. And point to one person at the table. Go. And the person that has the most fingers pointed at them is now our table leader. Yes. So let me tell you what table leader means. You make sure that they stay on topic, right? So you have in your folder questions to discuss, topics to discuss in your folder. So as the table leader, you want to make sure they stay on topic. And then be prepared as table leader. You can appoint someone, because you now have the power and authority, to appoint someone to kind of report out from your group when we get to that point. So isn't that awesome to be the table leader? Or any questions about what we're about to do? Yes, Esther? Okay, thank you so much. Our virtual people, you are not left out. There are breakout rooms being set up now, so you may already be in one, but choose the virtual room that you want to go to, and we'll be back to talk to you all as well. So virtual folks, you're not left out. There are breakout rooms based upon the topics of marijuana, opioid, tobacco, and alcohol. All right? Any questions about the team leaders? And I'll let you know there are going to be subject matter experts. Subject matter experts, raise your hand, walking around. So I see John, he's the opioid subject matter expert. So if your topic is opioid, John, wave your hand again so they know who you are and they can see you. Kay, are you doing alcohol? Okay. Michael Mumford, you're the subject matter expert that'll be kind of walking around facilitating for alcohol. Awesome. Dr. Reduka, you are marijuana. So if you have a green folder, you want to be looking and talking with Dr. Reduka if you have any questions. And then who has tobacco? All right, who's our subject matter expert for tobacco? Okay, that will be Kay. All right. So Kay Manning and tobacco is over there. All right. Any questions? We have about 20 minutes-ish that we will have for a discussion. I'll come back and just kind of do a check-in, and then we'll have a few tables report out. Thank you. Thank you so much for joining us and returning back to the big group. I know, just out of order. Thank you so much for that. We appreciate your attention. We appreciate your coming back and joining us. We thank you so much. Thank y'all. So with that, I want to recognize if there's any table that wants to kind of share one topic or something that came out, a nugget that really stuck out for you all. So I'll start with alcohol. Is there someone from alcohol, one table, to talk about a couple people? Because this whole area, I think, had alcohol. We'd love to hear from our young people. Oh, y'all had tobacco. Okay, who had alcohol? Blue. Okay, I'm sorry. Blue. Yeah, a couple things that that were important to you that you want everybody here. And look, I have a mic. This mic, Steve. We finally get to use it. Yes. So as a facilitator, you got to give someone else the mic. Yeah. So I think I can go out this far.
All right. So we were discussing the trends and how alcohol seems to have gone down, maybe because of COVID. We don't hear of it as much, it's not as prevalent. The big parties that were pre-COVID don't seem to be happening as much post-COVID. That when there are parties where maybe there are 4 to 6 kids that are there instead of the 20 or 30 that might have been before. And we were also discussing how parents sometimes feel like, well, they're going to drink anyhow. I prefer if they're going to drink to go over here and drink there. The social hosting piece with alcohol, and that sometimes if parents realize, and maybe in our advocacy, sharing the dollar cost, what you could lose, what's likely to happen if a child hurts themselves after they leave your home, that may be more of an effect than just saying, oh yeah, let them go over here and drink as long as they're together and drinking. We'd prefer them to do it there than be on the street drinking. So that's something that we thought would be a really good piece was to start sharing actually what your loss could be if you're caught social hosting.
Awesome. All right, thank you. Give it up for the alcohol group. All right, so we have, is this opioid? Yes. Who from this table has been designated? Okay. All right.
My name is Jesse. I'm from Cobb County Fire Department. We work as a community-based paramedicine team, as a referral-based entity, of which in the community we try to get people from the point of crisis, from when something initially happens, and bridge that gap between the hospital and the rest of the health system that is there to support them. At this table, we already found that we've kind of got multiple areas covered. We've got prevention, we've got in the field, and we have the hospital setting. So just discussing through what we did, I think prevention is pretty well covered, and that's a good thing. I think communication and cooperation between the various entities in the healthcare system would be greatly improved. I think a lot of people fall through the cracks, and that's where they tend to go back down any kind of vicious cycle, whether it's alcohol, opioids, or any other substance abuse. So bridging those gaps from the system so that it's a transition from one to the other, and focusing on the root causes, mental health-wise, that's why we go back down those vicious cycles.
Let's give it up for the opioid group. Michael, anybody sharing on the line? Not yet? Okay. So we have marijuana. Where is marijuana? Okay, Dr. Reduka.
All right. We really didn't have a marijuana group. Hopefully virtually they did. But I would really encourage you and maybe even plead. I won't get down on my knees, but we really need marijuana advocates. It's a very crucial time, a very important time. As Carlton in his excellent presentation said, the only line going up right now is marijuana. And I think that's because, we adults are trying to recreationally legalize it in so many states. And that's definitely what's coming to Georgia too, unless a lot of us get together and try and stop that train. So that takes education. As 501c3s, you can educate your legislators. You may not be able to lobby, but you can educate. And that's just so important because the marijuana industry is, Carlton also said, $1 billion industry. So it is David and Goliath. We're definitely the David, but that doesn't mean it can't be done. David won.
That's how the story ends in my book.
Yes.
And look what the tobacco preventionists were able to do when people must have told them, "Oh, you're crazy. You can never prevent that." So, plead with you. We do have a virtual booth. It's a wonderful booth from Let's Be Clear, Georgia. So please visit our virtual booth. Lots of videos, documents you can get from that booth. Michael Davis, Dr. Davis, is the vice president of Let's Be Clear. He works incredibly hard. And Michael Mumford is a past president of Let's Be Clear, and he contributed greatly. So these guys know about the marijuana picture also. So if you want to get with me, Greg Reduka, go to clearga.org, which is one of our websites. We also have social media. We also have letsbeclear.org, which is for youth. So letsbeclear.org. Marcio Cavalcanti, who is here, helped design that site. Yeah. Letsbeclear.org is a wonderful site for young people. Younger people than me helped design it, so it's really cool. Please go.
Wait, Carmen. We did have a group that did marijuana, talked about marijuana prevention and online, and they said that they were concerned about how the communication and the opt-out concept without lobbying was one of the things they talked about and concerned. And then just to continued, they would wanted to talk about since opt-out would be a specific ordinance, the parameters of advocacy. They talked about how they could be involved advocating at the Capitol and the need for more people to speak up in their community, since there's a lot of misinformation put out there that marijuana is safe or as medicine. So that prevention message coming out saying, here are the facts that we know by science.
Awesome. Thank you so much for sharing that out. Now we have tobacco. So we have a pretty big tobacco group. So could I get 2 people from the tobacco group? And you may have to come up because I don't think my cord goes back quite that far. Right. Tobacco. So our team table leaders, you identify who one person from your table. So we need 2 people. Yes, come on up. And come on up. Yes, ma'am. 2 young ladies. Okay. No, we can have 3. Come on. We got room for 3. You got the giggles. I love the giggles. All right. Do I need to stand with you or you got this? Okay, I can stand.
We discussed how there is wide availability for younger people who use to the use of tobacco products. Stores that sell tobacco products create trends as well as peer pressure and other mental issues. Also, the rates that has been risen for the vape usage.
Give her a hand. Thank you. So vaping and tobacco becoming a big issue. Not becoming, it is a big issue, and our youth see it. They know it. Come on up, our next presenter.
Good afternoon, everyone.
Good afternoon.
My name is Sky Ransom, and I am from the Hancock System Middle School as a part of TAC. Our group discussed about tobacco in our school and community. When we first thought about it, we thought that no one in our community really did tobacco or smoked or vaped. But then we had really thought about it, and then we realized that a lot of people are actually vaping. So we had thought to have more events to promote, but to prevent people from vaping and smoking cigarettes, and yeah.
Using. Yes, yeah.
Great job, great job. Thank you so much. What I heard from that is we didn't really think it was an issue, but when we actually got the data, right? When we actually started to dig into the work, we saw that there is an issue, and they are now doing events and things to really tackle that issue. So awesome job, Hancock. Come on now, Michael. You better hook that thing up. That's right. All right, bring it on around. All right, here you go.
Okay. Hello. My group, we talked about finding straight from the source, because everybody.
There you go, right there. Good.
Okay. So we talked about finding it straight from the source, because for some reason, for nobody to have it, everybody has it. And we don't know where it's coming from, but everywhere it's rising and rising and rising. So find it from the inside. Good
job. Take it down from the inside. Take it down from the inside.
Yeah, so with finding it from the source, we thought about different ways that people can still come to, nowadays nobody wants to talk about drug prevention, teenagers, they're too into, snitch type thing. So it's there's ways where you can do that, but still not feel the need to, without feeling bad about it. You would want to do it for their health, for the people, because the after effects are so bad. You're ruining your relationships, your future, but you're not realizing it because it's so normalized and so fun, so addictive, so relieving. But then when you realize it, you wonder why nobody wants to be around you in the end, or why you've turned out the way you have, and all the plans that you wanted to do, but now you can't, because either you got into big trouble for it, or you just fall down. And you can't get back up, but you can. You just still don't realize it. Okay.
All right.
Y'all, did Rihanna not just give us a great message, right? A great speech? Awesome, Rihanna. Thank you. Yes. Sort of thinking through as young people, that is not necessarily snitching. It really is helping your classmates, your friends, those people that you are in the community with, really helping them and getting to the source. That was a powerful conversations. So thank you all so much. Online, you have something?
Yeah. So the vaping and tobacco room said One person, Tasha, said that they learned that menthol covers up a lot of the negative things about tobacco. Oftentimes, so adding those flavors in might attract people to, because it covers up the taste. And if they know who wants to do something that tastes bad, so they use the menthol as a cover up on that. And then they also talked a little bit about how to engage youth advocates and getting the youth to speak up and be a part of their prevention message, and learn some awesome ways to get youth to talk about what they're seeing in their schools with their peers and with each other. And then we have a lot of people that are saying, great job, ladies, for sharing and representing the youth voice. So there's a lot of shout outs to you all, the three of you, for sharing in front of the whole group and online, and they hear you. So keep talking and sharing your truth.
Awesome, awesome. Thank you all so much. So we have a giveaway we're going to do, and then we have a quick role play. As Nicole is coming, I want to remind you that online that you have access to the virtual platform, those of you all that are virtual, of course, but even those of you all in the room, when you registered, you should have been given access to the virtual platform, and on there are tons more resources. So you have the resources that you discussed in at your table and as it relates to your topic, but there are other topics that may be interest to you. Dr. Raduca already mentioned about Let's Be Clear. They have a booth there and tons of resources for you to download and make a part of your prevention packet, if you will, or your prevention arsenal that you're able to take out and share with your community. So know that you have access to that. And then we have an advocacy table that's available today. Tara is over there. Tara, would you raise your hand so they can see where you are? She is over that table. There's a wheel to spin and win some of those prizes over there even. And then we have Dover to Dover Youth Advocacy Toolkits. The adults in the room or the adult advisors in the room, if that's something you want to take back to your organization, they're available for free $99. You can't beat that price, right? But also with that, you get support from V4P to connect you with the training and how to implement those advocacy tools within your community. So adults, be thinking about that and go over to the advocacy resource table. So you ready for one more prize? All right, let's go. We have now this, what is this? Oh, the earbuds. Here's earbuds, wireless earbuds. All right, let's see. Mixing it up, and here we go. 666016. Oh, yay, Leah. All right, congratulations. Can you hand that to her? Okay, we have a role play that, where's Shannon?
She's here.
Oh, okay. Shannon is going to lead us through. Shannon and I are going to lead you through. Go ahead.
So pretend, if you will, that I'm meeting up with Senator Caldwell in the elevator of the Capitol.
I'm just saying.
Or the stairwell under the rotunda. And so I'm painting the picture. This is where you are. Or we're in the community Piggly Wiggly. In Upson, there's a Piggly Wiggly. Yes. Or Winn-Dixie.
Can I say one thing? I'm sorry.
Yes.
I see y'all having to leave. Get lunch.
Oh, yeah.
Please go and get lunch. Yeah, so.
Look, let's give these youth some.
Yes, thank y'all so much.
Youth.
I know
Youth.
we're over a little bit. We ran over. We started a little behind, but yeah, go around and you can go out that door and back around and get lunch because, you know.
Please don't leave without your lunch
Awesome.
box.
Sorry about that. That's me being the senator to make sure I provide lunch
Senator
for
Caldwell
everybody.
is going to take care of you. Okay, so we are in the. Do we want to be in the Capitol or the grocery store?
Let's be at the grocery store because I like food.
Okay. So we're in Thomaston, Georgia.
Okay.
We're in the grocery store there on the produce aisle.
At the Piggly Wiggly.
Yes.
Because that's in Thomaston. I know that.
Good morning, Senator Caldwell. How are you?
Hey, I'm great. How are you?
You just trying to get your produce this morning. I won't take much of your time.
I am, but it's okay. I always love to talk to my people.
Good. I'm Shannon Lawson. I
Hey,
work with the
Shannon.
Council on Alcohol and Drugs, and I
I've heard of
specifically
that
work
before.
here in Thomaston on prescription drug abuse prevention work.
Okay, 1 second in the back. Hey, y'all. Okay, that's me.
No problem. And listen, I just wanted to let you know that we were in your community that you represent and what we do. We work to prevent youth substance abuse, misuse.
So important.
And specifically here around prescription drug abuse prevention. And the main two ways we're really trying to reach out to the community is to teach and inform and educate our community members around safely storing our medicine and securely disposing. We're so fortunate here in Thomaston. I know you're aware of our 3 drug drop boxes.
I am.
The sheriff's office, the police station, and in our CVS, our Walgreens.
Uh-huh.
I apologize, Walgreens. And I just wanted to know, I wanted to see if I could send you some more follow-up information and maybe get your email address and send you an invitation to our upcoming DEA Take-Back Day.
I would love that. I would love that information. Let's
Awesome,
schedule
awesome.
something. If you go to my website, there's a place you can link and schedule an appointment. I would love to talk more with you.
That's fantastic. Now, go around the corner and check out those pineapples. They've got them on sale today.
I love pineapples. Thank you
Awesome.
so much. All right. So a simple role play, but just how quick and easy you can meet and just have a short, brief conversation about what you do, your organization does, and then set up the follow-up appointment. And then at that appointment, opportunities for you to share resources. And I'll say, sometimes you may not meet directly with that person. You may meet with the staff person, and that staff person oftentimes has more knowledge, if you will, about the topic and can bring that information back. So I can't say this enough that they need our voice. Like, they don't know the issues. There's no way, when you think of all the issues that our policymakers are faced with, all the decisions that they're making, there's no way for them to have the depth of knowledge that they need around this. And so we are the resource, all right? So can I hear you say, I am the resource?
I am the resource.
I am the resource.
I am the resource.
That's right. We are the resource in our community, and we want to make sure we have that available for them. So I want to thank you all again for participating. Those of you online, thank you for sticking with us. Those of you in the room, thank you. And we have one more big giveaway, the tablet. I want to remind you all online that there will be a giveaway coming to you all. I think that's going to be announced once everything's kind of ended and we see the calculated points for those who have been participating. Based upon your point value, you will receive a prize. So the tablet is coming, and the giveaway. You have the box? Okay, you see it. Okay, awesome. All right. And again, don't forget our step and repeat. Take pictures in the back. We have a virtual photo booth. If you go to the back, scan the QR code, you'll be taken to that and be able to take pictures with it. All right. So big giveaway. Can I get a drum roll for this one? Yes. Awesome. Okay. 666-024. 666-024. You got it? Oh, yeah, that's right. I forgot about Georgia School giveaway, so we got that coming up. All right, so this is the tablet. I'm looking over at the table just to make sure I'm on the right course. Okay. I'm looking at my boss. 752-013. 752-013. All right, congratulations. Yeah. Our tablet winner. All right, congratulations. I think somebody's going to come get a picture of you because, that's what we need. All right, yeah. All right. So we have 2 giveaways for our Georgia School that are going to be given away today based upon these tickets. One in the room today. And yes, he is. We want to bring you up to give us words about this giveaway and about Georgia School. Let's give Chris a round of applause as he comes.
Good morning, everybody. Some familiar faces, some non-familiar faces, but for those of you who don't know me, my name is Chris Wood. I've spent the last 30 years in substance abuse prevention. Started in 1990 in upstate New York and moved here to Georgia in 2003 working for DHR. And we had, back in the day, substance abuse prevention office at 2 Peachtree, we had 2 people. That was it, and then we had our regional specialist. But I'm here today. I actually just came back to Department of Behavioral Health as the Director of Learning Development. So good to be back with behavioral health, but I also serve as president of the Georgia School of Addiction Studies. So I am here today to give away a prize. I am here today to give away a full registration to Georgia School of Addiction Studies. This is our 15th annual conference. It occurs down in Savannah at the Hyatt each year, the last week of August. It's a 4-day conference, about 4.5 days actually. And the registration is $525. So, yeah. Yeah, so your odds of winning are pretty good right now. So we are also asking you, in your folders, there is a save the date for the Georgia School.
Save that date.
Our call
to
for
the
presentations was supposed to have ended about a week ago. We have extended it. One of the reasons was for this event, that I wanted to make sure you knew that we had, you had the ability to come down and actually speak at Georgia School, that you could submit a call for presentation. So if you know someone who's a great speaker, please let me know. But if you'd like to present, go ahead and submit a call. You get a half off registration as the primary speaker, so that's a good thing. I think that's it. And if you don't want to present, please attend. We will be going full. Last year, the Hyatt would only allow us about 325 people to attend. It will be back to normal again. We are an in-person conference, so we're expecting anywhere from 400 to 450 people. So come down to the Savannah at the Hyatt. We have a great time. It is a very special conference. It's near and dear to my heart as a preventionist. So, and someday I'll tell you why that is the case. So, all right. God, getting older sucks. It kills me. 666 008.
Oh, I was close.
008.
I was close. It was me. No, I'm just kidding.
Do you want to let her gift it to somebody? Let me do this. This is a show. Who has not been to Georgia School as a prevention person? Okay, so we got a few. I'd love for this to go to someone who is. What's that?
I said, do you want to gift it? She said, I don't want to pay. So we can take their tickets and just pull from that.
Let's do that. So give me my non-DBHD people, my fellow employees. Or remember your number. Yeah, remember the last 3 digits. Because the first 3 are easy to remember. Like, how did that happen? What's up, John?
There's one more first timer. Carmen, one more.
So August 28th through September 1st was Georgia School. We do plan on bringing back our keynote speaker, our big showcase on Tuesday. So typically we bring in a celebrity speaker for that. So we're looking around for somebody.
Shake it off.
Oh, look at that. All right. $525 free registration. You do have to pay for your own lodging and travel, okay? Here we go. Does it say it? Drum roll. I can't read it. 666-018. Hey! I think it was just a bad pen. Congratulations.
That's an awesome prize. Thank you so much. Again, thank you to each and every one of you. We have lunch over here to my left, your right. Thank you again for participating. Any last words, DBHDD? Okay, thank you. And you can eat lunch in here. We still have this room. Remember to go online for the next 30 days. You have access to the virtual platform. But don't feel rushed. Get your lunch, come back, sit, continue to network and talk. Thank you all for a great day, because it's not night yet. Thank you. Thank you, virtual people.